Have you ever looked at your blood test report and felt completely confused? Terms like red blood cells, white blood cells, hemoglobin, and platelets can sound overwhelming. But a complete blood count, also called a CBC test, is actually one of the most common and important blood tests doctors use to understand what's happening inside your body. This single test can provide clues about your energy levels, immune system, oxygen supply, infections, inflammation, and even bleeding disorders. In this video, we'll break down the CBC test in a simple and easy-to-understand way. By the end, you'll have a much clearer understanding of what your blood test is actually telling you. What is a CBC test? A CBC, or complete blood count, is a blood test that measures different types of cells circulating in your bloodstream. Your blood is made up of several important components that work together to keep your body functioning properly. The CBC test mainly looks at red blood cells, white blood cells, platelets, hemoglobin, and hematocrit. Each of these components has a specific role in keeping you healthy. Doctors often order a CBC test during routine checkups, infections, fatigue, weakness, dizziness, inflammation, or when trying to diagnose different medical conditions. Because blood travels throughout your entire body, it can provide valuable information about your overall health. Red blood cells. Let's start with red blood cells. Red blood cells are responsible for carrying oxygen from your lungs to the rest of your body. These cells contain a protein called hemoglobin, which binds to oxygen and transports it through your bloodstream. Your organs, muscles, and tissues all depend on oxygen to survive and produce energy. When red blood cell levels are too low, your body may not receive enough oxygen. This condition is commonly known as anemia. People with low red blood cells may experience tiredness, weakness, dizziness, pale skin, or shortness of breath. On the other hand, very high red blood cell levels can sometimes indicate dehydration, lung disease, or other medical conditions. This is why doctors carefully monitor red blood cell counts in a CBC test. Hemoglobin. Hemoglobin is one of the most important parts of your blood. It is the iron-containing protein inside red blood cells that carries oxygen throughout your body. Without hemoglobin, oxygen would not efficiently reach your tissues and organs. Low hemoglobin levels can reduce the amount of oxygen delivered to the body. This can cause symptoms like fatigue, headaches, dizziness, and low energy. Iron deficiency is one of the most common causes of low hemoglobin. However, blood loss, nutritional deficiencies, chronic diseases, and certain medical conditions can also affect hemoglobin levels. A CBC test helps doctors identify whether hemoglobin levels are within a healthy range. White blood cells. White blood cells are an essential part of your immune system. Their job is to protect your body against infections, bacteria, viruses, and other harmful invaders. Whenever your body detects a threat, white blood cells respond quickly to help fight it. There are different types of white blood cells, and each plays a specific role in immune defense. If white blood cell levels are elevated, it may indicate that your body is fighting an infection or inflammation. Sometimes stress, medications, or other medical conditions can also affect white blood cell counts. Low white blood cell levels may weaken the immune system and increase the risk of infections. This is why doctors often pay close attention to white blood cell counts in a CBC test. Platelets. Platelets are tiny cell fragments that help your blood clot. Whenever you get injured or start bleeding, platelets gather together to help stop the bleeding. Without enough platelets, even small injuries could lead to excessive bleeding or bruising. Low platelet counts may cause easy bruising, prolonged bleeding, or tiny red spots on the skin. High platelet counts can sometimes increase the risk of abnormal clotting. Platelets play a critical role in protecting your body from blood loss. That's why platelet levels are another important part of the CBC test. Hematocrit. Another value commonly seen in a CBC test is hematocrit. Hematocrit measures the percentage of your blood made up of red blood cells. It helps doctors understand whether your blood contains too many or too few red blood cells. Low hematocrit levels may suggest anemia or blood loss. High hematocrit levels may occur in dehydration or conditions that increase red blood cell production. Hematocrit is often evaluated together with hemoglobin and red blood cell counts for a more complete picture. What abnormal results may mean. An abnormal CBC result does not always mean something serious. Sometimes changes in blood counts can occur due to temporary infections, stress, dehydration, medications, or nutritional deficiencies. However, abnormal results can also help doctors identify underlying medical conditions that may require further testing. For example, low red blood cells may point toward anemia. High white blood cells may suggest infection or inflammation. Low platelets may increase bleeding risk. The CBC test acts like a window into what may be happening inside the body. This is why doctors often combine CBC results with symptoms, physical exams, and other medical tests. Why CBC tests are important. The CBC test is one of the most widely used diagnostic tools in medicine. It helps doctors monitor overall health, detect abnormalities early, and track how the body responds to illnesses or treatments. Many conditions can affect the blood long before noticeable symptoms appear. Because of this, CBC tests can sometimes identify problems at an early stage. Regular blood testing can help doctors better understand changes happening inside the body over time. In conclusion, your blood carries important information about your health every second. A complete blood count test may seem complicated at first, but understanding the basics can help you feel more informed and confident when reviewing your results. Red blood cells carry oxygen. White blood cells defend your body. Platelets help stop bleeding. And together, these tiny components work constantly to keep you alive and healthy. Understanding your body is one of the first steps toward taking better care of your health.